Hello, everybody, and welcome to the Texas RMOMS Spark session. My name is Dr. Anna Terranova, and I'm the program director for this HRSA-funded Texas RMOMS Network program. And during the session, and together with our Texas RMOM leading team, we will be presenting on expanding telehealth for improved maternal outcomes in rural regions. So let me introduce you to our network. The Texas RMOMS program focuses on women of childbearing age that are residing in the following 6 counties. Uvalde County, that's the bright orange color, and then from top down and left to right, colored in yellow, the following counties: Edwards, Rio, Kinney, Uvalde, and Zavala County. Many women that are residing in those counties are Hispanic, and overall, the level of education, low median income, and inadequate access to care result, unfortunately, in health disparities. All those factors also have an adverse impact on social and health outcomes. So these 6 rural counties are included in 2 separate service areas of West Texas. One of them is Del Rio, Texas, which is in Uvalde County. Again, that's the orange one on the map. And the other one is in Uvalde, Texas. As you probably guessed, it is situated in Uvalde County, which is in yellow. These rural communities located about roughly 120, 160 miles west of San Antonio, Texas. And our partners in Del Rio are Uvalde Regional Medical Center and Uvalde Rural Health Clinic. And in Uvalde, our partners are the Federally Qualified Healthcare Center Community Health Development, or CHDI Inc., and Uvalde Memorial Hospital. University Health System in San Antonio, that one is located in Bexar County, which is colored as navy blue on this map. And UHS is the lead applicant for this program. The health system serves Texas Public Health Region 8, that is the overall colored region on this map, and therefore includes orange, yellow, teal, and dark blue colors. So the University Health System, it's important to note, is a level 1 trauma center for South Texas, and also is a level 4 maternal fetal care center. The health system offers consultations and also transport for high-risk maternity patients. Now, I'm turning the microphone to my outstanding team leads of this program, Ms. Mary-Luz Martinez and Dr. Mercedes Ingram.
Thank you, Dr. Terranova. Now, Dr. Ingram and I will be discussing the innovative ways in which expanding telehealth will improve maternal outcomes in the rural regions that Dr. Terranova just described. I am the program coordinator for the Texas RMOMS program, and Dr. Ingram was actually one of the grant writers for the application. She currently has the role of lead data analyst, which requires data collection from rural partners for evaluating the process and outcome measures that we report back to the HRSA funding agency. As you can see, telehealth is a large component incorporated into our model as a means to connect providers in the Uvalde and Del Rio service areas to their rural patients. It will also be used to connect to specialty care at University Health System in San Antonio. The IT departments at each organization will be involved to set up a telehealth unit and ensure that it is supported. This strategy will support health information technology applications in each of the rural areas that were discussed. We have partnered with University of Texas Medical Branch for consultation and training on telehealth equipment. Recently, they conducted surveys and virtual visits at the rural sites to determine the proper equipment, lighting, and connectivity for the room where equipment will be placed. We have already seen that increased connectivity will play a big role in expanding the capabilities at each site.
Currently, we are leveraging telehealth in several ways. One way is through education coordinated with our medical director, Dr. Patrick Ramsey. The medical director is responsible for facilitation and coordination of the neonatal services among Texas RMOMS Health Network members. This will be done through an echo-like telehealth model that will provide clinical information and statistics as required for a successful maternal and neonatal services operation. Monthly learning sessions will take place with providers in each partnering organization, where hospital and clinic staff will discuss emerging trends, review high-risk cases, and determine various treatment solutions. Regular provider meetings will also take place to discuss specific cases, as well as provide general maternal and child health information. The program medical director will also be available for case consultations on an as-needed basis. Another way of leveraging telehealth is by enhancing providers' skills and knowledge of maternal and fetal health, as well as educating them to recognize and respond to the early warning signs of obstetrics emergencies. The program's multidisciplinary team of providers, which includes doctors, nurses, midwives, nurse coordinators, perinatal case managers, doulas, and other health providers, will engage in regular telehealth consultations and case study presentations to enhance their skills and increase their knowledge related to maternal and fetal health. Part of this program's innovation will include extending other types of telehealth services to rural patients beyond obstetrics care. We'll be offering perinatal case management and behavioral health consultations through telehealth to rural patients unable to attend in-person appointments. Also, postpartum services will include behavioral health consultations so that upon transition from postpartum, patients returning to preconception can continue to be accessed via telehealth from the FQHC and rural health clinics to ensure continuity of care and provide the best maternal and fetal outcomes possible. The challenge that we are addressing with this innovation is to leverage and expand telehealth resources and specialty care for high-risk pregnancy and postpartum services, including neonatal care in these rural areas. Currently, referrals are made for specialists to treat maternal conditions that can be monitored locally rather than transporting patients to San Antonio for higher level care. By connecting rural providers with maternal fetal medicine specialists through telehealth, they will be able to get answers to questions or seek consultation from a specialist about cases in a timely manner, and reduce the burden placed on patients to travel out of county. Thereby, this would reserve time for the maternal fetal medicine specialist to provide advanced care for pregnancies that have medical, surgical, or fetal complications that are unable to be treated in Uvalde or Del Rio.
This innovation supports equity by coordinating with Medicaid regarding state telehealth parity laws for private insurance and Medicaid. By working together, we will support pay or reimbursement for medical visits in a similar fashion to in-person prenatal visits, postnatal, or specialty care maternal visits. Through the partnership with Medicaid, we will define telemedicine health services covered, healthcare provider eligibility to practice telemedicine telehealth, informed patient consent, and restrictions. We plan to implement this innovation within the next 6 months, and our measure of success will be determined by an increase in rural providers' usage of telehealth, along with an increase in billing for telehealth maternal services. These measures will sustain network services after the program has ended. To summarize, the Texas RMOMS program will use telehealth innovatively in several ways. It will increase education to rural providers, not only in using telehealth, but also to use it in the treatment of high-risk maternal cases. It will improve networking between all sites through case studies and regular communication at provider meetings. Lastly, it will increase access for patients to attend perinatal and postpartum appointments, as well as provide access to case management and behavioral health telehealth appointments. Through these strategies, telehealth will increase equity to rural patients and providers. Our contact information is provided in this slide. Please feel free to reach out to us for any questions or additional information. We would be happy to talk to you about the Texas RMOMS program or how we are expanding telehealth to improve maternal and fetal outcomes. Thank you for your time.